waiting, let me share with you a starter of our AeHIN Hour. Are you seeing my screen now? So I hope you can see my screen now. Hello everyone, this is Aliyah Evangelista from the Asia eHealth Information Network. Welcome to this month's special AeHIN Hour, where we talk on various topics concerning technology for health. The time now is exactly 9 a.m. and here in the Philippines, we are broadcasting from the National Telehealth Center in Manila, Philippines. Our topic for today is learning public health informatics, nuts and bolts, competency-based informatics training at CDC with our speaker, Dr. Herman Tolentino. Before we start our session, let's have a quick orientation on how we can make the most of our presence today in this AeHIN Hour. We're now using Cisco WebEx Meeting Center, and if you are encountering problems as you participate, please log out the session and rejoin the meeting room immediately. Our meeting room number is 869-703-562, and our password is Atlanta123. Your mic will be muted for the rest of the meeting, and if you have questions, you can type it in the chat box located on the right panel of your screen. For your questions, you can chat it in the chat box, or you can click the raise your hand button directly so you can voice out your question to our speaker. And on our moderator signal, he can unmute you so you can talk to our speaker. So for our introductions, please chat your name and designation in our chat box so we can know who we are inside the meeting room. As you have seen, you can write your name and your designation in the chat box right now. So thank you for those who are chatting their names and their designations. Please chat it to everyone. And please stand by for a photo-taking session so we can document your virtual presence in this AeHIN Hour. And lastly, please answer the evaluation form, which I will be emailing you this morning. Okay, today we're very lucky to have a facilitator from our AeHIN co-chairs team in Thailand, Ms. Jitsupa Pillay. Ms. Jitsupa received her degree in statistics at the Chulalongkorn University in Bangkok and her master's in nursing informatics at the University of Utah. She is specifically interested on public health informatics and is now working at the Thailand Health Research Institute. She is an assistant of our AeHIN coach in Thailand, Dr. Bunshai H. Let's welcome Ms. Jitsupa. Hi, Ms. Jitsupa.
Hi, Aliyah. How are you?
I'm fine and very happy. Yes, very well. So maybe you could do the introductions to our speaker this morning.
Okay, so hello everyone. It's nice to be here, and I'm very excited to facilitate our session for this afternoon. Without further ado, I'd like to introduce you to our speaker today, Dr. Herman Tolentino. Dr. Herman is a physician and health informatics practitioner with experience in designing, developing, implementing, and evaluating information systems using public health, clinical, and community health. He is currently working in developmental capacity building situations, creating and implementing training programs for diverse stakeholders. This includes using games for learning, event-based surveillance, data visualization, use of mobile technology, working with open source software. Dr. Herman, you are on air now. Please greet the participants for our AeHIN Hour. Hello, Dr. Herman. So there might be a technical issue.
I think he's preparing now for his slides, Jitsupa.
Oh, okay.
Can you see her screen?
Can you hear me?
Right.
Yes.
We can hear you now, sir. Go ahead.
Okay. Yeah, I was speaking when my microphone was muted. So I'm happy to be with you all. I know I can recognize some of the names on the screen, and I know the two. I don't know if you've met Bipat Kuruchitam from Thailand. He's a graduate of our program. I think he also watches presentations from the network. So I'm happy to be here, and before I start, I'd like to show you the website of the Public Health Informatics Fellowship Program. So this is the website. So you can go look at the information there. If you want to apply to the program, and then the competencies that I'm going to discuss is based on competencies that we developed a while back with the Association of Schools of Public Health at the University of Washington Center for Public Health Informatics. So I'll be describing this a little bit. Now, just to let everyone know, on CNN, you can see this headline: Southeast faces our biggest enemy, ice. In a few hours, we will be hit with a winter storm, and so I hope I don't get cut off, from you guys. So I hope we have good timing. So can I begin my presentation now?
Yes, go ahead. And
Okay.
stay safe.
All right. So let me begin. Okay, let's go to the. All right. So can everyone see the screen? All right. So if you can see the screen, just holler on the chat box. I can see the chat box from here. So all right. So the title of our presentation today is about learning public health informatics nuts and bolts. And I'll be talking towards the end. I'll be talking about competency-based informatics training available at CDC. So this is the outline that I am going to use for today. First, I'll give you an informatics overview, then I'm going to talk about the nuts and bolts, which is the mental models that we use in the fellowship, that also we use in the other fellowships. And essentially, I'll be talking about cycles and layers. And then I will be describing to you the applied definition that we use for public health informatics. And hopefully this will serve as your scaffolding to help you remember what it is. Because what I will do is I will dissect the definition so that we can get to the different parts of it. And then I'll talk a little about informatics competencies, especially the ones that we use in the fellowship, and how we actually use it to improve public health practice. And then I'll be briefly speaking about our training programs that we have in our center. And then if we have time, we can go into a little bit of a question and answer session. So does that sound okay? So I hope that everyone can. Okay, everyone can see the slide. So I'd like to begin by describing the continuum of information from molecules to population, so that you know that corresponding to that continuum, there would be subfields in informatics. So if you look at the left side is bioinformatics, and on the right side is public health informatics, and essentially that continuum spans the study of the different dimensions of information from molecules to populations. So if you remember this slide, you'd easily be able to remember how public health informatics is related to the other kinds of informatics. So it's just increasing levels of complexity from molecules to populations. So informatics involves the study of information dimensions of systems, different levels of organization. So there's public health informatics. Now, the next thing that I'm going to talk about are the mental models that we use in the fellowship. And essentially, everything that I'm going to talk about, we can reduce them to cycles and layers. So either they're cycles or they're layers. So I hope that that would be very easy to remember. So essentially, we talk about cycles. They're, in life, you see them as transformations, they may be transformations that create value, and they unfold over time. So like life cycle, that's one thing. A butterfly coming from a caterpillar, that's a transformation. And then you also have, again, in life, in systems, living systems, you have layers of complex systems where you have different components interacting within those layers and across the layers. So I hope that by remembering these two things, you'll be able to understand public health informatics better. So now we get to the next slide. So now I'm going to show you the definition, the applied definition that we use. And basically, it's made up of 4 components. So I'd like you to remember the 4 components, because at the end of the lecture, I'm going to give you a quiz. I'm just kidding. But I'd like you to remember the 4 components, because if you remember the 4 components, you'd remember really how we use public health informatics. So there are 4 components. So we define public health informatics as the systematic application of knowledge about systems that capture, manage, analyze, and use information to improve population health. So essentially, the definition is actually a statement of means and ends. So the first 3 components are the means, and improving population health is the end of those means. So we carry out those means to achieve an end, and the end is improving population health. So at the end of the lecture, I'd like you to be able to remember this definition. And again, one very important thing is that we pay attention to knowledge about systems, and the ensuing complexity of the systems that we deal with, whether we're dealing with public health or healthcare, because these are complex, very complex systems. So let's begin with the end in mind. So I'll start with the end goal, which is improving population health. So we define population health as the distribution of health outcomes of a group of individuals. Is defined as the health outcomes of a group of individuals, including the distribution of such outcomes within the group. And in improving population health, we work with a variety of stakeholders within a complex health system. The Institute of Medicine recently redefined the role of governmental public health as being the glue that brings together these different partners to be able to collectively deliver their impact of improving population health. So these partners consist of a range of different kinds of organizations coming from communities, from clinical care delivery system, from employers and businesses, from the media, from the education sector, from other government agencies other than public health. So in fact, if you're thinking about youth violence, for instance, easily you'd see that you'd have law enforcement involved, you have the school district involved, you'd have healthcare involved. So the work of public health really involves bringing together a variety of stakeholders so that we can collectively deliver the impact of improving population health. And in improving population health, we cannot help but ask how do we improve population? First, we have to measure something so that we can improve something, because we cannot improve what we do not measure. And we begin by looking at the things that we need to measure, and they fall along different boxes, so to speak. You may have distal factors like cultural context, political context, education, poverty, social connections, workplace environment. You may have more proximal factors to an individual like diet, activity, alcohol, smoking, self-identity. You may have intrinsic or physiologic factors like cholesterol, blood glucose, blood pressure, and such similar factors. And then from the interactions of different kinds of, you may have diseases or injuries like diabetes, cardiovascular diseases, infections, violence, and out of that you'd have health outcomes like you'd have loss of function or disability, sense of well-being, or even death. And so we collect a variety of these kinds of information, and we collect them using information systems. So we capture norms and analyze them, and we convert data to information to knowledge, so that we can drive policies and programs that deliver decisions and interventions and collective actions to improve, to improve health outcomes and to improve the distribution of health outcomes within within the population. And we do this within the context of a complex health system. And by looking at this diagram, one can clearly see that that information systems play a critical part of this health system feedback loop. It's a complicated business. And what we can just say is that public health is definitely an information-driven enterprise. We cannot live without information. We cannot make decisions. We cannot make accurate, correct decisions without being driven by information. And information systems provide us with a feedback loop that drive public health programs and policies. And if you think of population health measurements, we can think of several kinds of information or measurements. We have descriptive, predictive, explanatory, evaluative. Actually, put here the reference for this slide, so you can go read further on the classification of population health measurements. So essentially, these are the descriptions for each classification of measurement and the realms or the domains in which they're applied. And so essentially, when we collect information, these are the kinds of measures that we collect using our information systems. Now, the funny thing about collecting information is that nowadays, we run into the challenges of big data. And well, I put big in parentheses because we don't only deal with big data, but we also deal with small data, or data where data about very rare conditions, and typically these kinds of data would have certain characteristics, and I'd like you to think of these characteristics because well, they should be very easy to remember because they all start with B's. So I gave you the first one, variety. What do you think are the others? So we have variety in terms of sources of information, the formats, types, structures, transmission. So the other V's would be, well, one would be velocity, because nowadays we can really generate information at very rapid rate and create and generate them and even transmit them, at high speeds, which would require, higher velocities of computation and even higher velocities of, we should be able to consume as fast as we generate. So these are, really big challenges. And of course, related to velocity would be volume. And when you think about volume, especially very large volumes, then you run into problems of storage. It may be easy. Again, it's one thing to be able to store big data. It's also another thing to retrieve them, and also another thing to be able to do computation and consumption of a very large volume. Then the other thing that we also need to think about, another V, is veracity. Do we trust the source of information, where it's coming from? Do we trust its integrity? Is the content complete, or is it can we verify the contents that data has? And the other V, of course, there are more V's than we can put in the slide, but one other important V that I'd like you to think about is voids, meaning you can have a variety of sources of data, huge volumes coming at very high speeds, but they might be incomplete. They might not be comprehensive. In fact, you might have a lot more noise in that in that huge volume, more than you have completeness. There may be, the data may come in fragments, and the other issue, of course, is that the data that you're collecting might not even be representative of what you need. So these are at least the 5 V's that I could think of, and maybe you could actually think of the other V's. So and we can discuss the other V's later. So begin to think about the other V's. Now, the diagram I presented to you earlier really is very complicated, but there's an easier way to remember it. So think about the three components of the health system feedback loop. So the first is the upper left hand part of the diagram that I showed you is just simply the health determinants and outcomes. And then we do measurements using information systems, and those drive collective action to again help improve health determinants and outcomes. So essentially, this is the health system feedback loop. And information systems again play a critical role in this feedback loop. Now, the third part of the definition that I'd like to talk about is, remember, the third part is it's a systematic application of knowledge about systems that capture, manage, analyze, and use information. So I'm going to talk about the capture, manage, analyze, and use information. But there's two more steps. There's planning and evaluation. And we call this cycle the information value cycle. Now, the information value cycle is a way to remember that when you deal with data as you collect it, first you need to plan. You need to think about the organizational context in which you're designing an information system. You need to think about information needs. If you're implementing an information system, you need to think about change management issues. And of course, you need to think also about resources, financing, the workforce that will operate the information system, that will implement the information system. And if it's going to be a part of a system of systems, then you need really to think about information systems architecture. And hence, this is where standards become important. Then when you begin to capture, you think about methods of capture, the data types, and again the big challenges, the 5 Bs that I mentioned earlier, would become important in the capture. And then when you in the manage step, you think about storage retrieval, transformation, meaning transforming data to other formats that are useful for other kinds of stakeholders. Then you'd really also be at this point be thinking about, once you've collected the data, you've stored it, you might think about exchanging it with other entities or organizations. And of course, as you manage and exchange data, you need to think about data protection, information security. And you might also think about integrating the different data sets that you have at this point. And then in the analyze step, aside from the traditional analysis, you might want to do visualization, classification, aggregation of data, record linkage, and more at a very higher level, you'd want to do knowledge representation. How do you represent all the data that you have so that you can seamlessly combine them and mix and match them? And then the next step is really related more to now improving population health by enabling decision support, situation awareness, or dissemination of health information. And there may be other uses that I did not mention here. Now, when it comes to evaluation, you think about going back to your inputs, processes, outputs, outcomes, and impact to evaluate any information system that you develop. And in spite of evaluation being in the last step here in this diagram, it doesn't necessarily mean it needs to be last. Actually, in the planning stage, you already think about evaluation. So you think about, how do you know you're capturing the right data? How do you know that you're generating value at the step? How do you know you're generating value in the manage step, or in the analyze or use? So you think about evaluation across all these steps. Okay, someone said I'm speaking too softly, so I'll try to speak louder. And the eventual goal for the information value cycle really is to be able to transform data to information and then to actionable knowledge that drives public health action. And hopefully, by being able to evaluate what you did, that you'd gain enough wisdom to be able to do things better the next time around. So if you really look at the information value cycle, it's not a one-time cycle. It's actually a very this is a very iterative process. If you think about it, really it's like a spiral. The spiral goes up. You repeat. You continue to evaluate and plan for improvements, and then you implement your improvements in your capture, manage, analyze, and use of the data. So I hope that makes sense to everyone. So this should help you remember this part of the definition by remembering this mental model. And information systems must generate value in each step, or something must be wrong with that information system. Now that we've talked about information systems, I can't help but go back to really what is a system. Eventually you really want to think about if you have an information system, what is a system really? Well, it is a whole with a purpose and has interacting and interdependent parts. And the funny thing about systems is that if you look at the parts cannot provide the system function. For example, if you have a car, which is the function of which is to carry someone from point A to point B, the parts of the car cannot do the system function, meaning the wheels cannot carry the passengers from point A to point B, but the whole car does. The steering wheel can, one wheel can't, the door can't, but the whole car can. And when you think about systems, when you think about implementing solutions with a limited understanding of a system and its interactions with larger systems, this can lead to unintended consequences with time delays. So think about the car as a technological feat. However, in the context of a bigger environment, meaning urban planning, how streets are, how roads are designed, you can end up very easily with traffic jams. Last week, we had a snowstorm. We had barely 2 inches of snow, and the whole city ground to a halt. So you can imagine these kinds of interactions. And then, of course, on a larger scale, you can have air pollution, traffic congestion, and in information systems you can have siloed information systems and even siloed professional practice. If different disciplines are not trained to collaborate with each other. Now let's go back to the concept of an information system and just very simply think about it as people, process, and technology, and these three things need to be aligned so that this can lead to a better functioning information system. And not only do the three things need to be aligned, but the information system itself, excuse me, it needs to be aligned with the organizational context as well, meaning with the the organizational information culture and all that. And at this point, I'd like to bring up the other mental model, which is the concept of the information system within its context. So at the core of an information system, you have data that you convert to information and to knowledge. Then you have the information system that's made up of people, process, and technology. And the technology part is, it can be paper, it can be any computing or communication devices. It may use communication networks and software applications that support information management. The context, the context is made up of two things. It's the organization, and within that exists within a larger context of the environment. The organization is characterized as something with mission, with a structure, with an information culture, with values, with informatics capacity that has programs and policies. And it exists in a bigger context of an environment where you can see technology trends, social cultural factors. You can also see health system factors, legislation, other information systems, and even other bigger systems that may impact how information systems are used or even developed. And so what's really also important to remember is that among these different components, you may have interactions across the layers. So environmental and organizational context may affect how information systems are designed, developed, implemented, and used. So the funny thing about information systems is that you may think about developing information systems to affect the organization, and its bigger context. However, that bigger context also affects how information systems are developed. So this is kind of like a very complicated thing to think about, and you have to think about the interactions. Now, we're at the first part of the definition, which is the systematic application of knowledge about systems. So the systematic application involves a great part of it involves looking for informatics problems and trying to solve these informatics problems. When we look for informatics problems, typically we look for gaps in value creation. So this goes back to the information value cycle, and we think about where the gaps are happening. So the gaps, as far as two mental models are concerned, you can find them. You can have data problems, you can have information system problems, you can have problems in each step of the information value cycle, or you may have context problems. And the thing to remember about the information value cycle when you think about using this for analyzing information systems is that it's very important to think, if you're studying an information system, you have to be cognizant about what stage of development is it in. Is it in the design development phase, or is it in the implementation and maintenance phase? Because this context kind of helps you think of where you can get the most leverage. So when you're an information system in the design and development phase, you can maximize opportunities for prevention of downstream downstream problems by maximizing what you get from designing and evaluation and planning. While a system in its implementation or maintenance phase, largely you're looking for opportunities to improve those steps that are highlighted here, or in which case you may also, if it's for upgrading, or you may think about rethinking or reframing existing problems so that you can redesign this kind of information system. So really, when you think about information systems using from the perspective of the information value cycle, it's really about continuous quality improvement. By the time you have improved, it's already obsolete. So you go through several iterations, from iteration 1, 2, 3, iteration X, all the way to iteration X. And typically, this is how you should be able to improve your surveillance systems. Now, information systems in the enterprise. Now you have to think about system of systems, and when you think about how different systems can potentially connect to each other, now you've got the problems of interfaces. Like for example, if this is typically how you can envision occupational safety information interfacing with healthcare, with environmental health systems, with foodborne illness information systems, with law enforcement information systems, labor department information systems, or injury prevention systems. So you can think about this, but without using standards, you'd have a hard time linking all these kinds of systems. So in fact, when you think about systems interoperability in the enterprise, you should think about like an information superhighway here on the left. You can think about those different systems just plugging into that superhighway, and they'd be able to bring in and exchange information with the other systems. And I'd like to really at this point compare this to an analogy of here in the U.S. we have the Eisenhower interstate system. It's a very nice system that allows you to travel from point A to point B, anywhere in the U.S. and wherever you go, you'd see almost similar signs. You see speed limit sign, rest area. If you go the wrong way, you see that sign. Then you know where to exit, and the labels of places that you're going to are clearly represented by by very consistent symbols. So they're really standards. So the Eisenhower interstate system is a very good example of using standards. And then when you think about interoperability, that you might have alignment challenges. If you think about the disk model, that onion-like structure that I showed you earlier, you may have challenges creating interoperability of different layers. And one of the most important things you need to think about is that human-to-human interoperability is important, if not more important than the machine-to-machine interoperability, because before you actually are able to implement machine-to-machine interoperability, the humans need to talk first, in most contexts. And in the context of the information value cycle and the disk model, the data information system and its context, the corresponding layers, in fact, may be asymmetrically developed. Meaning, let's say if you're talking about two countries trying to exchange information between two systems, you may have a different level of maturity in one country compared to another, and that may present problems when it comes to exchanging information. So when it comes to informatics problem solving, this is a systematic approach to apply knowledge to real-world issues. So we define a problem as a recognized gap between a current state and a future state. So if you're able to define a problem this way, you're going to be in a great situation to solve it. In fact, Albert Einstein said that if he's given a problem, he would spend 55 minutes defining it and 5% creating the solution. So really, defining a problem is a very important step whenever you're trying to solve an informatics problem. Because if you can't define an informatics problem, you won't be able. From a living systems perspective, it's like a disease or a disorder within the information system that prevents the creation of value. So in fact, you may also want to think about it as information pathologies, which are preventable gaps in distributed information processing. When information that can be applied to a decision-making process is producible and not produced, is procurable and not procured, transmissible and not accurately transmitted, and applicable but not accurately applied. So you can begin to go into different kinds of methods like root cause analysis to figure out why are we having these kinds of preventable gaps in information systems. And so, diagnosing and treating informatics problems is like, you're looking at the patient and you see the problem, and then you try to diagnose, you analyze, you diagnose, and just from the nature of the problem, you can even probably predict where it's going. And then you can recommend or provide informatic solutions, and then you follow up or track your outcomes. Because again, whenever you never really stop at recommending or developing a solution, you try to follow up and track how the solution is playing out over time, because it's a living system and it's interacting with a context, it's interacting with other factors, and at one point it may be working, at some points it may fail in the future. So and this should help you improve by tracking your outcomes. This should help you improve how you define the problem. Did I define the problem correctly? Did I collect the right information? Did I recommend the right solution? And then this leads you to become a better problem solver in informatics. So how do you become an expert in informatics problem solving? Well, this is another mental model that I'd like you to remember, and it's made up of 3 parts. So right now, in this model, it's somewhat complicated because of the different parts, but I'll show you later a very simplified version of this. So the problem-solving framework that we use in the fellowship is made up of 3 parts. There's the problem-solving inputs, there's the problem management part, and then there's the part where you actually improve your performance in problem solving. So the problem-solving inputs, it's made up of 3 parts. There's problem-solving scenarios. In our fellowship, we have 3 scenarios at least that where fellows do a lot of problem solving, like they engage in short-term technical assistance projects with different kinds of agencies. They do informatics evaluations, and they work on projects in their centers. And then one of the things that we make them pay attention to is their problem solver ability, AeHIN competencies, how they define problems, how they store problems in memory, their metacognitive skills, and somehow how their attitudes, motivation, and volition can affect their problem solving ability. And then exchanged to these 2 factors, you have resources like time, assets, mentoring, and supervision. And then in the problem management itself, I kind of created an acronym here. It's called, if you notice, there's an embedded acronym in part B and C, and it's called the acronym spells nail it, and essentially it has the main parts of problem representation, solution design, solution implementation, and outcome tracking. So those steps entail. It's called nail it. And those steps entail the steps that you take to go through problem solving. So if you're able to describe the problem and its context, you're on your way to be able to know what additional data you need to collect, what potential causes could be leading to these, leading to the problem that you're seeing, and then you could come up with a list of solutions, and evaluate those solutions and their outcomes. And then you pick a solution and implement a set of recommendations. And then you track your outcomes. So in the fellowship, we track our outcomes for our technical assistance projects over 6 months and then up to a year. So we know how those have played out over time, and what else we could learn so we can improve the practice. So the loops all go back to the first steps, and how the problem solver can improve his ability to solve those kinds of problems. So in a nutshell, I'd like to share this back with you. It's the problem-solving framework is really a cycle. There's problem-solving input, there's problem management, and performance improvement. Now we get into the part where I describe informatics competencies, and one of the famous uh, uh, folks that we often refer to in teaching and also in computer science, Hubert Dreyfus. He said, to be competent, you have to feel bad. And so there are many times, when our fellows in the program can feel bad, either because they're failing. Not that failure is bad. In fact, failure is good if you learn your lessons really well. And and what they try to develop in the fellowship is, they try to develop expert performance by doing, by going through many of these kinds of problem solving situations. And by increasing the level of experience, you'll somehow uh, have many opportunities to increase your level of performance. And again, you can have three possible outcomes when you try to do that. Either you further increase your performance as an expert, you're going to arrested development, or they may end up with really low level of performance with just performing everyday skills, not extraordinary performance. So and the way we use competencies is, so in the gray parts of this slide reflect the domains in which our competencies are classified. So we have competencies under community dimensions of practice, cultural competence, communication, analysis, assessment, and evaluation, and we have public health sciences. And at the bottom, underline everything, we have leadership and systems thinking. And the practice of these competencies enables us to involve informatics practice, which enables us to better support public health practice. So I hope by remembering this diagram, we're able to describe the role of competencies in improving informatics practice and consequently in improving public health practice. And one of the things that we pay attention to, that we ask the fellows to pay attention to, is that not only is the fellowship about learning, but it's also about unlearning. There's many things that you can unlearn, so that you can improve your practice. Now, let me get into the CDC Informatics Fellowship. This is where you actually practice those competencies. So we have 3 fellowships right now in our training program. We have a 2-year program, 1 2-year program, 2 1-year programs. So the first program I'm going to describe is the Public Health Informatics Fellowship Program. This is the original program that started in 1996. It's a 2-year assignment to a CDC center, institute, or office in Atlanta, Georgia. And we take in applicants with master's, doctoral degrees in informatics and in informatics and healthcare or public health. And we take in anywhere from 4 to 6 fellows a year. The training begins in the summer, and this is the only fellowship that accepts international fellows. The other 2 fellowships are field-based programs that we started because of the gap that we need to fill in informatics capacity domestically. One is the Applied Public Health Informatics Fellowship, where we bring in new people into the workforce. These are 1-year assignments to a state or local health department. Similar requirements in the fellowship in terms of degrees. We take in 8 to 10 per year, and the training begins in the summer. The other kind of program that we have is informatics training in place, where we train existing employees of state and local health departments. The training lasts for a year because of the varying degrees that we find in state and local health departments. We just decided, that we start with bachelor's degrees, and we can take any and we take anywhere from 8 to 10 per year. The training also begins in the summer. So if you notice, all the trainings of the 3 fellowships, they begin in the summer because they all attend the same orientation. So all the different kinds of fellows, they join the summer orientation. They get to know each other, and they form a professional network. One of the other things that I was thinking about as far as the informatics training in place program is the possibility that that this could actually also be done with ministries of health, but that's a topic for another conversation. Now, to begin to understand how those different fellowships are configured. So think about the workforce pipeline as where people prepare, they enter the workforce, and then they actually enter the workforce, and then they become part of the existing workforce, and then they exit or they retire from the workforce. So essentially, the informatics, the Public Health Informatics Fellowship Program, APHIF, they address gaps in the entering workforce. The training in place program, they address gaps in the existing workforce. Then we have other kinds of opportunities where we have internships, faculty development, where we host faculty that go on sabbatical. These are not very often. And then we have capacity building in POH, and we offer introductory courses in PHI. So I'd like to acknowledge Ramesh from WHO.
Sorry, Dr. Tolentino. We have like 15 minutes to finish the discussion. And actually, right now we are in the discussion process. Yeah, so if you want to finish your presentation, and then we can move on to the discussion.
Yeah, I have 2 slides left actually. So these are the faces of the people who have applied to the program in the past. This is a sample, so you can see the diversity of the faces. And so this is, that's my last slide. So we're now in the Q&A portion. So I'd like to open the floor for questions. Aliyah, do they speak their question or do they type it in the chat room?
Oh, I will address the questions to you.
Go ahead.
Okay. So excuse me. So the first question was asked by Dr. Alwin. He is interested in the fellowship program, and what he asked is, can U.S. CDC make the program available for implementation within countries in AeHIN? How do we go about this? And he also has a second question. Let's talk about the first question, then we will move on.
Yeah, well, that's a very good, that's a very good question, and it's something that I've been, really thinking about for a long time now, but I've not figured out a way to do it. But maybe we can have a separate discussion about that. How's that for an answer? We'll have a discussion.
Okay. So I think he also has another question. The question is, can U.S. CDC work with AeHIN to offer the PHI program in the member countries? This maybe need to be a separate session also.
Yeah, isn't that the same as the first one?
Yeah, I think the 2 questions are related. So we might.
They're related. So again, the answer to that would be, let's have a separate discussion about it. Maybe.
Okay. Yeah. Okay, so I'll take note on that. And actually, I would like to share with you. When I did my master program at the University of Utah, I actually worked with CDC NIOSH, and I did the training with them. It's just a short training in order to be able to code occupational information correctly. And I was involved in the project that helped develop an interface that can capture occupational information and kind of like incorporating occupational information into EHR. But I see that it is really difficult. And anyway, I would like to say that the CDC has really great training program, including variety of parts, for example, like NIOSH and I can't think of it right now, but yeah. So.
Yeah. What was I going to say?
So anyway, go ahead.
You must have, Tsuba, you must have worked with Dr. Catherine Stace.
Oh yes, she's my PI, and I was her advisee. I was her student.
Her.
Okay, so I would like to ask you for several questions. So this question is from Dr. Rajiv. He asks, is absenteeism recording really useful in epidemic detection? That is the first question.
Well, you probably would have to study. I guess the answer to that is it depends. It depends on the context of what you're using it for. And again, you have to study the data. Does it really maybe you can look at it. You can look at something retrospectively and analyze whether it really represents something that can be used, for event detection. So I can say, what I can say is that the answer to that is context dependent. You cannot have a uniform answer for all settings.
Okay. So another question from Dr. Rajiv. Is pharmaceutical data collection used for detection of disease in locality?
Yeah, you can use. I guess there's many uses for pharmaceutical data. Like I know, I have a colleague. His name is Jeremy Espino, and he works at the University of Pittsburgh. And he he actually utilized the pharmacy retail monitor, a very huge database for biosurveillance.
Okay.
So retail purchases of drugs, depending on the kind of drugs that gets purchased, those can be not by itself, but you use it with other kinds of data. Then it may help you be able to predict an event that's unfolding.
Okay. So another question from Dr. Alvin regarding the fellowship. He asked, can you mention some of the graduates of the international fellowship?
Yeah, I know we have one in Australia, Nilva Egana. She's a very recent graduate. We have Nick Jones. He's in New Zealand. We have one in South Korea, Mona Choi. In Thailand, we have one graduate. At Kuruchitam in China, we have one. So I think we have a lot of graduates from Asia.
Okay. So another question from I believe Vince. Will it be possible for online module as part of capacity building for AeHIN countries?
Mm-hmm. Can you kindly state the question again?
Sure. The question is, will it be possible for online module as part of capacity building for AeHIN countries?
Yeah, it depends on the level of that you want to build. So you can probably use online modules. Typically, what you can find in YouTube, for increasing awareness. However, for building for building skills that that matter in problem solving, you probably need a little bit something a little bit more involved. Like trainees working on projects, so that they learn so that they can apply. They have something to apply the principles to that they learn from training.
Okay. So actually, this is the question from Dr. Alvin, and I actually agree with him. He asked, can the PHI program be offered online? I think that would be really helpful for many people around the countries.
Yeah. So our experience from implementing the Informatics Training in Place program, it's a program that's really largely remote. So the trainees that we have in 5 states right now, who in the first, I mean they're not in Atlanta, they're in their workplace, and then we use their projects to actually help them apply the principles that they learn. So I think can it be done? Yeah, I think it can be done. It probably needs a lot of study, especially in a different context. I cannot definitely say that what works in the domestic U.S. will work in an international setting. Probably we would need to maybe implement a few pilots to study how to really best implement this kind of program in different countries. So that's how I would think about it.
Okay. Aliyah, do you want to move on to another session, or do you want to finish the discussion? I think thank you so much for your presentation and your thought on the discussions, and this is really grateful, really helpful for us. So
yeah, I'm happy to be able to help you and share what we have from over here.
Right.
Okay.
Thank you so much, Jitsupa and Dr. Herman, for the wonderful AeHIN Hour. I think Dr. Alvin wants to share something. Dr. Alvin, do you have your mic with you? Dr. Alvin is the chair of our network. Go ahead, Dr. Alvin. You're raising your hand.
Thank you, Jitsupa. Thank you, Dr. Herman, for sharing your program. I suggest we schedule that separate session that you suggested to talk about how we can also build up Asian capacity for public health informatics. I think we have some mentors already in the Asian region that we already know, like Dr. Bunchai in Thailand, and a well-crafted program that has the elements of the CDC components and also the practical experiences that need to be done in the workplace. I think it will be a win-win situation that we are able to get international principles practiced in local situation. So thank you, Dr. Herman.
You're welcome. You all have a nice day.
Have a nice day. But before we go, thank you so much for attending our AeHIN Hour. As I give the short summary for those who came late, I would like to invite everyone to open their camera and show their screens for our photo taking session. So while I am waiting for your screen to go online, today we talk about what is public health informatics as in the definition of as means to an end, and we also talk about the problems and issues in big data, and specifically with focus on trainings at the CDC Public Health Informatics Fellowship Program, of which, as Dr. Alvin has mentioned, would be helpful for everyone to apply and share their training to the Philippines, or not to the Philippines, but to their country as well. So can you show your screen before we end our slide? So now I'm seeing Dr. Alvin, Dr. Iris, Dr. Herman, do you have your screen with you? Art is on air. Waki. Okay, Dr. Shinji has done a Waki post when he was here in the Philippines. So I will just have a screenshot. Please freeze your smiles. Okay? 1, 2, 3, smile. Okay, I've got Art, Dr. Alvin, and Kong from Vietnam. Let me get the other screenshots of Dr. Iris and Dr. Avon, maybe. So let's try it again in the next batch. So I see Dr. Iris, Dr. James, who's celebrating his birthday today. Okay, smile for Dr. Iris, Dr. James, and Dr. James, you lost your video. Okay, 1, 2, 3, smile. Okay. So I've got that the batch of Dr. Iris, Dr. James, and Art. So I get Chitsupa, Dr. Shinji, Roy, and I get that 1, 2, 3, smile. Okay. So we have a lot of screenshots to share in our Facebook page. So thank you very much for coming. Last one I think I wasn't able to get screenshot of Sir Nova. Avon Nova. So if you're just on your station, just freeze your smile and we will do the screen capturing. Okay? So that's it. And the Sir Vince and Sushil, do you have your videos with you? I hope you got yours because we really wanted to share your virtual presence in this meeting. So I think we're okay. Thank you so much for being with us. We are ending at exactly 10 o'clock a.m. This Aliyah Evangelista. See you on February 28th for our next AeHIN Hour, more of capacity building series. Goodbye. Thank you.
Goodbye.